today, this ambulance and this ticker, the losing coverage ticker, symbolizes how significant the harm is for each day that we delay health care reform. It is clear that for those people who are uninsured, this is really an enormous tragedy. As health costs grow, as people have lost their jobs, as businesses get priced out of the health care they used to provide, more and more people who used to take health coverage for granted are being priced out of the health care and are joining the ranks of the uninsured.
Those numbers are about real people. They are about a young boy in my state. His name's Marcellus Owens, who I met just a couple weeks ago, 10 years old, who came to a healthcare rally we were doing and told me about his mom. 27 years old, single mom, working hard to take care of her young family, going to work every day, got sick, got sicker, started missing work, and her employer told her, you either make up the sick time or you lose your job. She lost her job, and with it, she lost her health care. Because she didn't have health care, she couldn't get in to see a doctor, and she died, leaving Marcellus and his family without a mother.
The system is broken. I don't know of anyone that believes otherwise. If you're one of the 50 million with uninsured, you don't need a lecture about it. If you have insurance, you're worried to death whether or not the costs are going to continue to mount, making it impossible for you to sustain it, or whether or not the coverage will be there at all.
For all the people we're hearing today who say this is not the time, too hard, too difficult, I think about Marcellus and all the other people I have met who've been impacted by this system that is not working for them today.
This ticker will be in Washington in prominent places until health care reform is signed by the president. And it will be there as a reminder that there is an enormous cost for delaying or denying health care reform. We need to get it done, and we need to get it done this year.
That's why we are working so hard in the committee, here in the Senate, to make sure we protect what is good within health care today, we improve what's not, and we provide access to the care for millions of Americans, including more than 830,000 in my home state of Washington.
Our bill does not tell you what doctor you ought to see, what hospital you ought to go to, what insurance coverage you'd like to have. If you enjoy and like the present plan you have, you get to keep it. That's important in this legislation. But if you want change, if you want better coverage, then we're going to provide that opportunity for you as well. And to provide that ultimate guarantee in this country, that if you lose your job, you don't have to be in a free fall when it comes to providing for your health care coverage and that of your family.
But it isn't just for the uninsured. It's for people today who do have insurance, who are paying a tax because they're covering all the people who don't. Average family of four pays $1,000 more today for insurance because the system isn't working for everyone. So that's why we are working so hard to get this bill out. Is it hard? You bet. A lot harder for Marcellus Owens, who gets up every day without a mom. We've got a lot of work ahead of us, but we are working to make sure that we finally, in this historic opportunity in this country, do what's right for America and the future.